Hello, everyone. It's Wednesday, July 1st, and on a very, very good note, we do not have any additional deaths in West Virginia, and we have our total number at 93. It's 93 too many. We are now within a very, very short rock's throw of testing 10% of our entire population. We've tested now 173,251 people, and I don't know if that's dead on or I mean, I know it's dead on the number of tests, but I don't know exactly the population number and everything, but we're right at the threshold of 10% now. We're now in week 10 of the West Virginia Strong Comeback Reopening Plan. You know, you'll see that we've got our fairs and our festivals and amusement parks and different rides and so on like that open and everything. I go back and caution you over and over and over to watch what is happening in the national news and watch what's happening in other states where people have been irresponsible. And I ask you over and over to remember all the guidelines that we've got out there for you, and we really want you to be smart, and we want you to be safe, and we want you to wear your mask. And so at the end of the day, we can continue to keep West Virginia moving in a positive way, and with your life as close to normal as we can possibly get it. We do not want to regress and end up with more of a catastrophic problem, you know, on our hands to deal with. And so we depend on you. We depend on these numbers. We're watching. Our experts are on top of it in every way, advising me, and we're going to continue to stay right on top of it. But we need you, West Virginia, so don't drop your guard, please. You know, as far as our revenue numbers, we're going through a slight little technical issue, a bump that's just happened and everything. You know, our revenue people will probably be better to explain that, but it just came to my knowledge 2 or 3 hours ago. They're all working it and everything, and in the scope of things, it's absolutely nothing. But at the same time, you know, we always want it, and we want it to be right. And these are the kind of mistakes we don't want to see happen and everything. But this is a very minute mistake. If you just think about it, if you think about what's happened in the last 12 calendar months, I say this over and over, but when you're looking at $4.7 billion, this amount of this mistake is less than 1 million. And so it is an oversight. The monies were in the bank. It is just, you know, there's no point in me dwelling on it. It is just a mistake, a mathematical mistake. Now, and we're getting it straightened up. But the long and the short of it is, if you look at the 12-month period, and this, of everything that has probably happened, you know, since I've been here, you know, this may very well be the biggest thing that we've ever been able to accomplish. You know, when we started down the path in July, August of last year, when we hit those months and they came in $66 million short, and then all of a sudden everybody was thinking, uh-oh, what's going on? And especially everybody was me. And then right behind that, September was supposed to really clean everything up, and it didn't hardly do anything. $7 million to the good, and we ended up $59 million in the first quarter down, and I think that's the right number. I could be off a little bit, but I think that's the right number. Now with that, we then immediately reacted and started down the path of how are we going to cut $100 million out of this budget? How are we going to cut programs? How are we going to cut salaries? How are we going to cut dollars out of this program and everything? Well, we held back on that, and we sputtered along through, you know, October, November, December, and all of a sudden that 59 million started to look a little bit better, But we all knew that if we didn't do the cuts, the later on it would be tougher and tougher and tougher to do them. But we held back. And as we held back, we kept getting better. And lo and behold, at the end of March's books, we were $6 million underwater. And April was going to take us to a surplus in a year that we were using a budget number that was the all-time highest in history from the year before. And we were using numbers that were dramatically inflated from the year before. And the year before's record surplus. So the long and short of it was, then all of a sudden, you're hit with this pandemic, and that quick, you're $198 million in the hole at the end of April. And you're thinking, well, what are we going to do? And what we did was we took dollars that we had in reserve accounts, and we used that cash to live on until the end of June the 30th. Now, through that time, in April, I was told by our revenue people that, Governor, you're going to be $525 million short. And, of course, I never really bought into that, because I believed that the thing that I've told you all along, that West Virginia really never shut down. And so we shut down the aspects to protect your health. We shut down schools and big gatherings and restaurants and bars and things like that. But we kept, as our essential businesses, we kept our engine running enough to be able to propel us economically. So all of a sudden, the numbers started then looking a little bit better. And May came in significantly better. And in the weeks of June, and June's a big month, in the weeks of June, it just got better and better and better. And so last Friday, we felt like we were going to be, for the year, $295 million short instead of $525. Incredibly better. But then all of a sudden Monday came and we were better. And on Monday I told you I think maybe it's going to be somewhere around 278. And then all of a sudden, lo and behold, after yesterday, and I got the call from everybody yesterday that said, our final number is $254.5 million. Now, I'm going to tell you this. If you take the reserve monies that we had and a little bit of payback money that the state paid money out and is able to replenish from the CARES Act, and that was, I think, $57 million. If you take that, we run across the finish line in West Virginia with a surplus in the year of the god-awfulest pandemic in the history of the world. Now, that in itself may be the biggest accomplishment that we've ever pulled off. And the bottom line of that is we deferred almost $200 million in income taxes that are going to flow into July that would have been paid back in April, and that 200 million or 170 or 80 million or whatever it may be is going to hit our books in July and jumpstart us for the future. Now, with all that, the other thing that is the neatest part of the whole thing was just this. By the percentage that the feds were backstopping Medicaid, we began to build dollars in the Medicaid surplus areas. And so when we get to June 30th now, we have bled down reserve dollars that we had sitting over here to be able to get us to June 30th. But as June 30th came, we had already built back dollars significantly more than needed to replenish the $150 million in Medicaid Reserve Fund, and Medicaid reserve or surplus at the end of June 30th, I was told yesterday, is going to be $218 million, with the forecast of 2021 to probably be just south of $300 million. So in other words, what's happened with us is just this. We have a surplus instead of a deficit for last year. The other thing is all of our accounts as far as the replenishment of our reserve has been done. We're going to build even more of a surplus in Medicaid without any backup in any level of services in any way. So the long and the short of it is, through a lot of hard work, we have accomplished something that probably no one could have ever thought we could have done. And it's part of the miracle. It's part of the miracle in West Virginia. I am really, really proud of the great work that our Revenue Department did and everything, and we'll now move forward from that. I want to tell you about our cities and our counties today. Thus far now we have awarded $24,097,000 and to 137 cities. There's only 137 cities and counties that have applied so far. We still need more to apply. And we're just trying to pump that money out as fast as we can get you qualified and get it out to you. Okay, let me jump back and forth here just a little bit. Okay, on Workforce West Virginia, Workforce has now surpassed $1 billion in unemployment benefits that have been distributed to date. The total number is $1,051,551 in employment benefits that have gone out. I want to tell you this, again, all you got to do is turn on the TVs and look and everything, but in other states, you've still got people standing in lines and standing around the block and everything, and we're lucky to have had the minor problems that we had. We know there are major problems to those recipients that were waiting on checks and everything, but we got it done. And, so I want to really commend Scott Atkins, his group, and the National Guard and all those that, put in a lot of licks to make that happen. On our jails and correctional facilities update, we now have one active case at one prison, and that's in Huttonsville. We are still yet to lose a single person in our jail systems and everything with this pandemic and this virus and so on. It's good stuff. Our testing now is going today. We're in Harrison County from 2 to 7 p.m. at the Robert C. Byrd High School. Next week, we will be in Mercer on July the 10th and the 11th. We'll be in Mercer, Marshall, Mon County, Preston County, and Wayne County. And again, these tests are all free. The more we test, the more we know, the better we'll be. Go out and get tested, especially our minorities and those that are the most vulnerable. In a state-by-state comparison by the Harvard-based research group, called Opportunity Insights, they found that West Virginia's consumer spending has returned to pre-pandemic base levels in the month of June. The research shows that West Virginia is among 6 states, including Arkansas, Michigan, Indiana, Kentucky, and Tennessee, and Maine, where all consumer spending is now higher than it was at the start of 2020. Myrtle Beach continues to be a problem. Now we have 115 cases. I strongly urge anybody that's been to Myrtle Beach to get tested. Really important stuff. So please get tested. As far as our summer feeding program, well, right there, I think we got 690 sites. We've fed in excess of 7,000 people, and in fact, it's in excess of up into 7,000s. And if you got a problem, call 211, and they'll be able to help you. I don't want you to forget your census and getting registered for that. Now, let me give you just this. Here's bad news. Here's bad news to me. But the national response rate to date is 61.6%. West Virginians, now this is free dollars coming from the feds to us. The national rate level today is at 61.6. You're at 53.2, West Virginia. Got to do better. You're a whole lot better than you were, but you got to do better than this. So come on, West Virginia, I need some help. So if we can have some people step up and everything, I'd sure appreciate the help. I think that's all I've got for right now, other than the fact that, let me just tell you this real quick, and that is on our charts, you know, our cumulative average is now at 1.69%. It dropped from 1.7. Our daily rate, you know, is kind of bouncing around and everything, but our daily positive now was less than 0.5%. All the numbers continue to be very, very, very good, West Virginia, but we've got to continue to just remember one thing, and that is wear your mask. Absolutely stay on top of what you're doing, and from all that, if you'll just step back from the whole thing and let me give you more inside baseball to us. We're constantly watching the number of people that we got in ICU, number of people we got on vets, number of people who are hospitalized, and you know, or vents rather, you know, ventilators, number of people in the ICUs, number of people on ventilators, number of people that are hospitalized, and it's all really, 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 really good. But West Virginia, come on, just keep doing it and doing it and doing it, and we're going to all run across the finish line with a miracle beyond belief. It's happening right here in West Virginia, so thank you.
All right, thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Just like to highlight some numbers from June. The National Guard supported 370 missions, 122 vehicles were sanitized, 4,900 contact tracing engagements were supported, 3.4 million pieces of PPE were distributed, and the Guard assisted our local and state partners in 8,000 tests for the month of June, as well as our volunteer groups and food banks in distributing 20,000 meals. Just a quick update, Mountaineer Challenge Academy, despite the pandemic and the distance learning focus, 80 cadets graduated from the program. We have 33 that have currently passed all the requirements for their high school diploma. We have plans in place. The majority of our cadets will continue back into the next class in July or into our Jobs Challenge initiative. We have good, solid plans and capability in place to begin our middle of July class. And in the near future, Governor will be announcing updates on our Mountaineer Challenge Academy South program, which is moving along exceptionally well despite the pandemic. Thank you.
All right, thank you, General. Secretary Bill Crouch from the West Virginia DHHR is also joining us today and is available for questions. Now we'll go to questions from media members. The first today is Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. Getting a lot of questions. You unveiled your plan Friday in regards to how you want to use the CARES Act funding, but I'm getting a lot of questions on the $100 million for COVID-related highway projects. And I'm very curious about how you all are interpreting the CARES Act and the U.S. Treasury guidelines to be able to allow you all to do that. What exactly is a COVID-related highway project? What does that entail? Can you go into more details about that? There's a lot of questions. I know Senator Manchin was on Fox News yesterday raising concerns about that particular issue. So can you explain it a little bit more? Thank you.
Stephen, I'm the one that needs to take that question and everything, and just I want everyone to really, really pay close attention to what I'm getting ready to say. You know, I came to you as a business guy. I didn't come to you as a politician, and I don't want to be a politician. I don't want to do that, and I won't do that. And I want to continue to tell you the truth and try to better West Virginia. Now, you know, a lot of politicians say that all the time, but they're just in a lot of ways just saying it. I don't want to be that. I'm going to tell you the truth. Senator Manchin, just raring and saying this and that and trying to throw out a political jab here and there and everything else when at the end of the day, if you just think about him saying something derogatory about us putting money into roads in West Virginia, these roads didn't get in this shape on my watch. These roads got in this kind of shape simply because we went decades and neglected our roads and pulled money away from the maintenance of our roads in every way. In fact, the reality is, then Governor Manchin sold our maintenance equipment. I mean, it's just the truth. It's nothing but the truth. And so all of a sudden we're in a heck of a shape. Now, in regard to the dollars, Stephen, again, not giving you a political answer, but in regard to the dollars and how it all works, it's just this. I didn't come up with the idea, to tell you the truth. Jordan Damron was walking through our office and said, well, what about this? What about, from the standpoint of if you had a road or a bridge that was close to a hospital and everything, and people had to drive an hour out of the way because of a slip or whatever it may be, would that road possibly qualify, the repair on that road? And then we could take those dollars that maybe we were going to use with those on that road and put them toward another road. Well, as we put the numbers all together, we could see over and over and over and over that we were going to have excess dollars. Now, so what did we do? We went and got every legal opinion that you could get and gave them all the information from the highway department on roads that were absolutely, going to be, that were vetted through the EMS and all kinds of different situations to be able to qualify. And then our expert opinions, our legal opinions said, absolutely, these roads qualify. Now, the $64 question that you need to ask Senator Manchin is just this. If we, in fact, are going to get to the cities and the counties all the money we can possibly get there under the guidelines and under the law, and we're going to get into small business $150 million that's going to go to every single one of our small businesses that qualify from 5 to 35 people, and then we're going to backstop ourselves and make absolutely certain from the standpoint of unemployment that we don't have our unemployment taxes go up and weigh on our businesses and crush our businesses. And then on top of that, you still got $100 million over here. Now, what does Manchin want me to do? Just send that back to the federal government? Or try to find a way that we can use that in West Virginia, that the federal government has given us those monies, and be able to use them? And we need to use them with our roads. That's all there is to it. Now, we can have people that are out there and all they're trying to do is come up with some political gobbledygook. This situation has been very, very, very difficult to manage. But you'll see in my stuff, there's no pet projects. There's no projects and everything that I've got put on a back shelf and everything, and I'm trying to usher through like a typical politician does. I'm doing it in a way that is in the best interest of all West Virginia. And that's exactly what we did. We got an opinion or opinions, and the opinions said absolutely for roads that will make it better for our people to be able to get to emergency service or to hospitals or to medical treatment and everything. Absolutely, they agreed it can be used there. And so we're working off of their opinion and everything, and the bottom line is we got down to the point in time where we had $100 million and we didn't have a bucket for it, and we could have done one of two things. We could have just sent it back to the federal government or tried to find a way that we could use it within West Virginia and use it for our people, and that's what we did.
All right, thank you, Steve. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Thanks, Governor Dave Mistich, West Virginia Public Broadcasting. My question is about this $1 million discrepancy that your revenue folks found yesterday coming into today. Could you explain a little bit more about what that is? This is the first we're hearing about it. And secondly, would that make the the budget from the last fiscal year that ended yesterday unconstitutional and unbalanced.
Okay, it's Dave. Is that correct, Dave? Like I said, I just heard about this 2 hours ago, and I think the best person to answer this is our Secretary of Revenue, and he can give you a whole lot better answer than I, and so I'm gonna defer to him.
Okay, sure. Yesterday at about 7:30, 8 o'clock, when we concluded our wrapping up the closing process on our revenues and expenditures, of course, yesterday was the last day of the fiscal year, June 30, we were about, $500,000 in the positive side of our revenue account, which is exactly what we wanted to be under state law. Of course, we're required to do that. This morning, when we came in and rebooted and got ready to wrap up our work and basically put fiscal year 20 to bed, for some unknown reason, and we're still trying to figure out how and when it happened and what time it happened, because we were looking at the books last night as late as 8 p.m., there had been a shift of roughly $1.375 million had moved out of the account. And we've contacted BB&T, our bank. We've brought in our budget experts. We brought in our folks from our tax department, our collection account, trying to determine what happened, because there's no explanation that we've been able to come up with since 8:30 this morning. As of about 15 minutes ago, we're still trying to determine exactly what caused that computer glitch or computer error of some sort. We've notified the auditor of that situation, and we've looked at applicable legal cases, and we plan to file whatever we need to correct the clerical mistake that was made. It clearly wasn't a substantive mistake, and was one that was done through the computer with nobody in the revenue department being involved. So our plan is to straighten that up today and get ourselves back in the black, which is what we need to do. And we're doing that in consultation with the state auditor.
All right, thank you, Dave. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question about something else, but just very quickly on that. Is there any chance that money was stolen, Mr. Secretary? So, if you could answer that in a second, but my main question is for Governor Justice. Governor, the health officer in Kanawha County is saying that we're doing fairly well, even though we have an increase in the number of cases, and we're hitting big numbers. It appears that locally we're not seeing a lot of community spread. What we're seeing is travel, which is having the biggest impact. So with that in mind, of course, the Summit Bechtel area is active, and we have a lot of scouts coming in, even though it's not a jamboree season. We've received several pictures and photos and videos from those activities in Fayette County, and it looks like there's a casual relationship with social distancing and wearing masks with those guys. Have you been in contact with the Boy Scouts of America about their policies, about safety? Because we're obviously bringing in scouts from all across the country, travel being the big problem that's causing a large spike in our number of cases.
Kenny, our people have been in touch. I've not been in touch with the scouts myself and everything, but I do know a lot about it. I've surely been really supportive of the scouts in the past, and all those that are coming stay on the property there. So all the people that are coming stay there on the Scout Reserve or whatever it is, the Summit Reserve and everything. But I can also tell you that many precautions, they are assuring me that my people have assured me that the scouts, that they've been over with the scouts and that they're doing on the property. But I also would say, all these scouts are staying there on the property, and so I think we're okay there. But Kenny, you bring up another point that is something that is looming in the back of my mind nonstop, and that's just this. As long as our numbers continue the way they are, we're going to have to stay on high alert and watch. The numbers are good, but at the same time, travel from out of state is absolutely concerning. And so it may very well be that we've got to back up and do exactly what we said we would do, either stop or back up or really reverse, our stride in which way we're going and look at the out-of-state travel coming to us.
All right, thank you, Kenny. Next, we'll go to Anthony Izaguirre with the AP.
Governor, have any of your private companies received any coronavirus loans, such as payments from the federal Paycheck Protection Program?
I think so, Anthony. I don't know exactly those amounts and everything, but I think so. Surely nothing from the state, but you'd have to ask my children about that. I don't know exactly what that is.
All right, thank you, Anthony. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, Governor, and everyone. It seems daily we have more and more businesses closing these states. Some restaurants and small businesses just can't get over the finish line. And so I'm wondering, when are these grants going to be available? When can the application process start, and how long will it take to get these grants to small businesses?
Mark, you got to ask your question one more time. I just couldn't quite get all of it. Please do it one more time.
Sure. I'm wondering, with the small business grants you're proposing, the $150 million, $10,000 going out to 15,000 small businesses, when will that application process start, and how quickly can you get that money out to the small businesses? Some of them are closing every day.
I surely understand, and that's been the effort behind the whole thing. But I think very, very soon, and by very soon I mean a matter of days and everything. But we've got to build in a mechanism that gives us the ability to prevent fraud. I mean, that's just all there is to it. And so our people are working it, and we're close, and we ought to have that out. Surely we'll have it out by the first days of next week, but that's probably when it'll come.
All right, thank you, Mark. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, ProPublica today reported that there was a positive case of coronavirus at the Greenbrier Resort. Are you concerned that, particularly with World Team Tennis coming in here shortly, that there's potential for an outbreak at the resort?
Well, Phil, I'd be lying to you if I didn't tell you that I'm concerned about every place in this state all the time. I don't know all the protocol and everything that is happening at the resort because I'm not involved, but at the same time are involved almost zero. But at the same time, I can tell you that, the Greenbrier Resort prides itself in doing things right, and they will be following every inch of the protocol every way. I do know of the person, that tested positive there. I think they were exposed to someone, I can't recall exactly who it is. It was someone at the, I don't know their name, but someone at the sporting club, and I think that they were a cook. And then I think what the protocol was everybody that they were exposed to, I think there was about 20 people there and everything, and they had to quarantine themselves for 14 days. But Phil, at every place we have, whether it be the Hatfield and McCoy trails, whether it be Snowshoe, whether it be, the Greenbrier, whether any place that we have, Stonewall, wherever it may be, I'm concerned for all of them all the time, as well as any of our fairs, festivals, anything we're doing, anything that happens, at Walmart, wherever it may be. And so we've just got to absolutely be just on guard all the time, stay on top of all of our numbers and watch and everything, and know, as I've said over and over and over, we're going to have some rough seas. This isn't over. I mean, that's all there is to it. And we're going to have to run to the fire. Now, we've got to really watch and not do something that's completely stupid, and we've got to absolutely follow the guidelines and watch, but we're going to have some rough seas. I know the Greenbrier's tickled to death that, the World Team Tennis people are coming, and that ought to be a neat thing for a lot of West Virginians to be able to enjoy and everything. And from the standpoint of all the social distancing, I think they're going to have, very small numbers that they're going to allow to watch the people, in the World Team Tennis play. And there's going to be, I think the stadium holds, 2,500 people, and they're going to have, distance between everybody that's there that's able to watch them. And so everybody's doing, for the most part, about everything that we can do. And as long as we keep pitching these kind of numbers and doing what we're doing, we'll be okay.
All right, thank you. Next, we'll go to Anna Saunders with WOAY.
Hi, everybody. Anna Saunders with WOAY here. My question is actually for Secretary Crouch in regards to the Summit Bechtel Reserve. It's my understanding that the DHHR was involved in that decision to allow the scouts to come back. So my question is, if a scout happens to test positive, will they have to isolate at the camp, or will they be asked to leave? And how will that work?
I answer that on the other side.
Yes, thank you for the question. And this was part of the governor's decision to open up the state and allow things to get back to normal. So we're watching that situation. The scouts are to stay on the property so that we don't have individuals throughout the community. So we're working hard at that. We do understand, I learned this morning that there are some concerns in the community about that. And of course, as the governor said earlier, a lot of what we're seeing is travel related. So the travel related for Myrtle Beach, for example, is really 115 individuals. And the interesting part about that is it's in 23 counties. So it's individuals who are coming back to different areas of the state. The scouts, if those scouts stay on site and they stay together, and still wear masks and practice social distancing as they need to, we're hoping for an event that is disease-free. So anytime you get a lot of people together, as we've talked about before, there's certainly a higher risk. And the whole issue is reducing your risk. So we think the scouts are going to work well with us to try to reduce that risk and make sure that they have a good time, and that scouts are able to do the things they need to do, but still keep the disease under control and not have any more spread in that area. So thank you for the question.
All right, thank you, Anna. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is also for Secretary Crouch. The other day, your office put out a press release saying that the investigation into the Randolph County numbers had concluded. It sounds like we know what happened there. Could you walk us through how that happened, what we're doing to prevent it from happening again? And could you tell us if we're on track to have corrected numbers by the end of the week, like that press release said? Thank you.
Absolutely. Thank you. Thank you for that question. The data piece of West Virginia surveillance system, that's our official system for the Bureau of Public Health. That system is, I haven't even found anyone to be able to tell me how old it is. I believe it's 50 or 60 years old. But that is our system that we collect data. What happened in that situation is we had the National Guard, thank goodness, to call, and they had been calling in the past to collect information from local health departments. In fact, that's how the system started when the pandemic first broke out, was the Guard and their folks contacting each county and getting information from the county in terms of active cases, in terms of then eventually recovered cases, which is where this issue came up. What happened was, and our folks, I'm taking a big part of the blame for that. We should have gotten better information out to counties in terms of closing those cases out. We should have made sure those cases were closed, and we should have had good directions and directives to counties to say, here's what you need to do to close those out. Those active cases are followed by individuals in the county. When an individual is determined to be COVID positive, the county health department follows that individual, calls daily, make sure they take their temperature, make sure whether they're asymptomatic or symptomatic, that eventually that disease has either resolved itself or a certain period of time has passed on asymptomatic patients. So Only the health department staff can close those cases out and put an end date into the surveillance system to say that individual is no longer an active case. Where we are right now is we're going through those cases, and we've asked the local health departments to work with us. They're our partners. They've done an incredible job under difficult circumstances, so we understand the difficulty with that. We are working with them to try to make sure all of those cases get closed out as quickly as possible. I believe we started out last week with, my recollection is about 248, a difference of 248. I think we're now down to about 170 or so cases that we're trying to get final determination on. We will fix this problem. We will make sure that we work with the local health departments to make sure it doesn't happen again. We have to have data to make decisions. The governor's absolutely correct, absolutely on target, that the data has to be accurate. If we provide information to the public with regard to this disease, we have to know how many, we have to know where these positive cases are, and we have to know how many cases there are. So I'm confident we're going to get to a number that everybody agrees on and that is consistent, and that we fix this problem. I'm on calls now with the local health departments. I have another one with this afternoon. I have another one. I have one on Monday. I had one on Tuesday, and I have one today. So trying to make sure that we're on the same page, that everybody understands the issues, and that we get this data reconciled and fixed. Thank you.
All right, thank you. Next, we'll go to Paul Mullen with WCBC.
Good afternoon. Good afternoon, Governor. Good afternoon, panel. Secretary Crouch, I'm coming after you again. Preston County, I'm looking at the numbers. They were involved in the Myrtle Beach outbreak. Your website has them at 64 cases with 15 probable and 59 already recovered and only 18 active. Do you have any idea how many are asymptomatic out of that number? How many were actual cases that were symptomatic? Could you go into that a little bit?
I'm happy to do that if I have, but I don't believe I have that information. I'm happy to do that tomorrow or in the next press conference when I get an update on that. Just do not have the details of that with me. Again, we want these numbers to be accurate. So if they're not, let's find out why and fix it.
All right, thank you, Paul. Next, we'll go to Annie Moore with WVVA.
Good afternoon, Governor. We're getting reports of businesses that are charging COVID-19 fees, some as high as $50 per customer. Are you considering any type of guidance to businesses on this, especially with all the federal funding coming in?
Annie, I really don't have any information in regard to this. Maybe if you could help me a little bit, or maybe we can dig into it, after we get through with the briefing and give you some more detail tomorrow. But I don't really have any information in regard to businesses charging a COVID charge right now. So, but we'll get into that, and get back to you, okay?
All right, Governor, I'll turn it back to you.
I've got two things, and, as Secretary Crouch, mentioned and everything, we're on the way to cleaning up an era in regard to our active and our recovered cases. I'd like you to put that chart up, Jordan, just 1 second. And if you could see where we're going with this and see really what's happening on the top line. As you'll see, the top line is now widened to a degree significantly more than at any time we've had since all the way back to May the 1st. And so as you'll see, that really and truly the numbers were surely wrong, and some way they just fell through too many cracks. But as the numbers are cleaned up, you should see even a more widening of our active versus our recovered cases. Thank goodness the numbers were wrong in a positive way to us. The last thing on earth we would ever want to report is a number to you wrong in the first place. But on top of that, it would have been really bad to have reported to you that things were really better than they were. Or reported to you a number that was better than it truly really was. In this situation, we reported to you numbers that were worse than they really were. In other words, basically, that we had people reported to you that were still sick that weren't, and they were recovered. So I'm really happy we're cleaning this up. It's a big error, and but thank goodness it was an error on the good side. And the only other thing I'd like to end up is say just this: that yesterday, we had a really wonderful thing happen with our family. Jill has had some real issues in her pregnancy, but yesterday she delivered a little 7-pound, 10-ounce little girl, and it was done at Johns Hopkins, and so we're really happy to have little Conley Caroline Long with us now, and so I appreciate all your thoughts and prayers, because she surely had a tough go of it. But the last thing is this too, is yesterday we also reopened our hospital at Fairmont, and it's going to be the Fairmont Medical Center in Marion County. It's the same facility as the Fairmont Regional Medical Center. And back in February, if you'll remember, it was announced that in 60 days, that hospital was going to close. And I said at that time, we just can't have this happen. I mean, we can't be in a situation where the 7th largest city in our state doesn't even have a hospital. And those people in Marion County, they absolutely deserve a lot better than what was getting ready to happen. And so 2 days later, I went up there and I sat with them and I listened to their issues and their concerns. I had the opportunity to go there with some of our legislative delegation, and we listened to the people, and you could see it all over their faces, just this, how much the people that worked there, how much they loved their hospital and how important it was to their patients. And the doctors were talking over and over about how important it was to the patients, and that the patients, if the patients had to drive 30 minutes to an emergency facility or whatever, how bad it would be. And then we really dug in. And I salute the people at WVU, because they really stepped up. And lo and behold, what we got worked out is just this. We got worked out to where we were able to shift $10 million of the CARES money there just to use that hospital in case we'd have a very bad COVID surge. But in addition to that, we got a real live commitment to WVU is on the way to building a 75 to 100 bed facility right there in Marion County. So yesterday was a gigantically special day to me and my family, with Jill and little Conley Caroline being here. But on top of that, to the people of Marion County, I congratulate you. I thank all the legislature. I thank WVU. I thank all those that were involved in everything, and hopefully we'll have a facility there in the future that everybody will really be able to be proud of and use, and everything worked just great. So that's all I've got right now. And, I'd say to everybody, continue to be smart in what you do. Wear your mask, wear your mask, wear your mask. I can't tell you enough, that there's situations that are breaking out all over this country. We still got a long ways to go. West Virginia, you've been the miracle. We've still got stormy seas in front of us. Continue to be the miracle, West Virginia. Thank you so much.